Good evening, everyone, and welcome to today's webinar, How to Increase Return on Investment and Patient Intake with Laser Hair Removal with Dr. Cartier and Petrina Nugawela. My name is Laure Boisseux, and I am the EMEA Brand Manager for Laser Hair Removal. During today's webinar, you will have the opportunity to submit text questions to Dr. Cartier and Petrina Nugawela by typing your question into the questions pane of the control pane. You may send your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. I would now like to introduce Petrina Nugawela and Dr. Cartier. Petrina Nugawela is the owner of 3 clinics in the UK. She has been working in the aesthetic for over 20 years and worked with luminous devices for over 10 years. Dr. Cartier is a French dermatologist based next to Lille. He is in charge of IMCAS Global Course Coordinator for all IMCAS congresses and is the Vice President of the French Society of Aesthetic Medicine. Now, I would like to hand over to Petrina Nugawela, who will discuss the trends in the hair removal industry, how to choose a laser hair removal device, and why she chose to work with the LightSheer Desire.
Thank you, Laure. Thank you guys for joining us this evening. My name is Petrina Nugawela, and I will be speaking to you today about the LightSheer Desire and how you can change your practice to be more lucrative. At the end of the webinar, like Laure said, you get the opportunity to ask us any questions. And if there is anything that I have missed, then obviously please feel free to ask us, and I'll be happy to answer those questions. As you can see, I've been in the aesthetic industry for over 20 years, and probably just over 10 years of that I've been using the luminous devices. I have most of their systems, but obviously we're speaking about the LightSheer today, and within my 3 clinics I have got 6 systems of LightSheer. And when I started my business, obviously most physicians and practitioners at the time that I started, there was a lot of regulation in the industry, and laser hair removal was actually done mainly by nurses or medical clinics. Obviously things have changed now, and my business was started on laser hair removal. That was my bread and butter. That's what made my business. Whereas at that time, a lot of my colleagues were into Botox and fillers, and that's how they started their business, and obviously then they grew. I've always been laser orientated, and I've obviously stuck to that, and I will explain to you why. I'm in a position now, like most of my colleagues, where I can go and buy any system that I want, but I tend to still stick to the LightSheer, because it is something that works, and it works not just for basically Caucasian skin, it works for Asian skin as well, and that is a big plus. So what we're going to be talking about today is the market overview. I've probably covered a little bit of that already, the basics of laser hair removal, the technology behind it, and then obviously the system itself, and then patient demands. So laser hair removal is obviously the cornerstone of aesthetics. And like I said, before, majority of the time, what I find with laser hair removal is that in our industry, in the physicians industry, nurses industry, sometimes we feel that it's a little bit beneath us, a little bit, we don't want to do the treatment. It's okay for a beautician to do the treatment, and that's fine. But it is a big, there are more people wanting laser hair removal, I would say, than somebody that wants Botox and fillers. The start of a person who wants Botox and fillers is probably the age of about 30 to 35, whereas I will have patients from the age of 16 wanting their children to have laser hair removal. And the average that you can probably, obviously the legal age is 18, but if you do have a doctor's referral, and if you are a doctor yourself, then obviously if there's a problem, then they can start a little bit earlier. So what I find with laser hair removal is that that relationship between the patient and the clinic is much more deeper, because you're seeing patients on an average of 8 to 10 treatments, and this is per area, and majority of patients have quite a few areas in a body to treat. The average price that we charge per patient, they spend about £10,000 on laser hair removal on their body, and that is lucrative. People don't mind. The other important thing to remember is that people actually don't mind talking about laser hair removal, whereas if they were having another aesthetic treatment, they're a little bit more private about it. It's not something that people want to talk about. So again, from a referral point of view, you're going to get much more people coming to your clinic, because people don't mind saying, oh, I had laser hair removal, I've had it at this clinic. If you have a sister or a family member come, you will most definitely have the rest of the family come. And then again, like I said, a mum will bring a daughter, a mum might bring her husband, sisters bring brothers in. So the referral fact is much bigger than somebody who wants to have, say, Botox or fillers or cool sculpting, because people are a bit more secretive about treatments like that. So what you can see from this graph, you can actually see the trend from 2016 to, obviously they've done it to 2021, but you can see how it's a growing market. It's not something, even though the market has grown where there are lots of people doing this treatment now, you've got lots of beauticians, etc. But on the other hand, there is more access to it. There's more people talk about it more. And because of that, it is a growing market. The main thing to remember in this industry is that just because it is something that people are doing a lot of, it doesn't mean that it has to be a cheap treatment. You can hold on to your brand and you can hold on to your value by using a good system, by giving people good treatments, and that means choosing the right people to do the treatment, not just anybody, training them, and using a company that actually stands by you. These are the things that make your clinic stand out. And by doing that, you can actually charge patients the price that you want to. In our clinic, like I said, hair removal is our base, our main bread and butter. And we've got people doing laser hair removal in every corner, but we have stuck to our prices, and we have our customers coming back. So this is just me again. I think I've covered a little bit of this already. You can see that, doctors obviously were the people that, nurses and doctors were the people that did the treatments before, but obviously things have now changed a little bit because the market has opened up. But like I said, that does not have to be a negative thing. It is just keeping your brand, being honest to yourself, and not because, the thing is, laser hair removal is not just about treating someone's bikini or underarms. When it comes to skin of color, it's a big problem, because majority of people, ladies, are having to shave maybe once a day, maybe once a week. So on their faces, this is something that is more than a cosmetic thing. It's not something that they do for vanity. This is something that they've got to do to look good, to survive. And if you open up your business to that market, you're going to have a client base for life. So having said all of this, how do you choose the right system? And what is the most important thing? So we know that wavelength, pulse duration, fluence, and spot size, and obviously epidermal protection, which is the most important things. We know that those are what we are looking for when we're looking for the right system. With wavelength, we're looking at the penetration, the collateral damage, and the absorption of melanin. And you will see, I don't know whether you can see the actual chart. The main players, in laser hair removal, the main players are the alexandrite at 755, the diode at 810. I will say IPL as well, because I do believe that if you use the right IPL system and you know the right parameters, I believe that IPL is perfectly fine for laser hair removal. And then obviously the Nd:YAG at 1064. So if you look at the graph, you can see that the ideal laser, obviously to me, is a diode. And the reason for this is that you can obviously treat Caucasian and skin of color with minimal damage, which obviously has a high melanin absorption. And this makes it perfect for both skin types. The pulse duration, this is where we come into. So short pulses are effective because energy is delivered faster that it can escape. Long pulses protect the epidermis because the heat can escape, preventing any heat rise. Obviously, to provide epidermal protection and efficacy, the pulse duration has to be shorter or equal to the thermal relaxation time of the target, which is obviously the hair follicle. And now we come down to the spot size. With the spot size, you will, this is actually, sorry, yes, fluence and spot size. So you can keep a small spot size, a high fluence, large spot size, obviously a lower fluence. When it comes down to fluence, it's important to deliver the right energy. You don't need to increase energy if you're reaching the right target endpoint. So people automatically, sometimes when in practice, sometimes I have practitioners who think that they've got to keep increasing the fluence, but you don't have to do that. As long as you're reaching that endpoint, then you're fine, because you don't need to stress the skin unnecessarily. And the last thing, which I think is pretty important, which is epidermal protection. So to bypass the melanin, you've got to think about contact cooling, which obviously with the ET handpiece, you do get that, you get a chill tip. We use a system called a cryo system, which is a cooling machine, which most of you might already have. Anybody that uses IPL or CO2 probably has one. And we pre-cool and we post-cool. And this is quite important, especially when you're treating skin of color. I just find that you can treat on a higher fluence if you are cooling the skin. And then obviously you can use gel as well, and then gel will help to protect the skin as well. So I'm looking at, okay. So what are we looking at as a business or as a physician? What is it that we're looking for in a system? A system that gives us, obviously we want results, because patients are not going to stay with you, and you're not going to hold on to your patients unless you give them results. The system has to be easy to use, because sometimes you're not going to use it yourself. You are going to expect your staff to use it. You need something that is fast, because nobody wants to come into the clinic like the old days and stay there for 2 hours waiting for their legs to be done. So you need something that's fast. You need a good price. Obviously, price point is important, because people don't want to pay over the top. It needs to be pain-free. That's a big thing, especially with the youngsters and with male patients. They can't handle pain. So, if you can offer them pain-free, then obviously you've got more clients. And I think the other thing that's quite important to me is that the system comes from a company that you have a relationship with, that you have commitment from the other side when it comes to servicing, when it comes to being able to pick up the phone and you can speak to their medical, the person that does the training. You need to have that relationship with that company. If someone's going to sell you a machine and then not want to have any contact with you afterwards, there isn't really going to be a good relationship. So I think that, to me personally, that is quite an important thing. And that is something I do get with Luminous, hence why, I have stayed with them. So now we're going to talk about the actual system. We're going to move into the system. So we've got, it's obviously a diode laser. We have a few handpieces attached to it, which I will go into in a minute. It is portable, which means that if you've got a clinic, maybe 2 clinics or 2 or 3 treatment rooms, and you want to be able to move the machine, that makes it a big plus because it's not bulky. These days, lots of people don't have big clinic rooms, and this helps because it's not that it doesn't take a lot of room. You've got the 810 handpiece, but then there is a new handpiece that they have brought in, which is the 1060. And that's an add-on. You can add that on if you want to. It has integrated presets. So again, this helps when you've got staff members doing the treatments, because you can basically choose the skin color, the skin type, the hair color, and everything is done for you. It gives you safe and effective treatments, and it also treats large areas, and there is one handpiece that is virtually pain-free. These are the 3 handpieces: the high speed, which is 22 by 35 spot size, the XC, which is 12 by 12, and the ET, which is 9 by 9. Now, if you want to, you don't have to purchase all 3 handpieces. You can buy the high speed, and you can maybe buy the XC or the ET. And you don't necessarily need to have all 3 handpieces. If you're a startup business, you probably don't want to have that commitment of having to buy 3 handpieces. The HS handpiece is delivered with virtually, like I said, no pain. It has the way that it works is that so you've got a flat surface, no gel. You place the handpiece on the surface of your skin. It sucks the skin up, stretches the skin, and it treats the skin. And at the point of contact where it's actually sucking your skin, that's where it gives you sort of a block where you actually don't feel the pain, because you're thinking about the sucking sensation, and that's the whole mechanism, the science behind that, the device itself, the handpiece itself. Then you have got the ET and the XC. Contact cooling, it has a chill tip. It needs gel. You can use it without gel, but most people do use gel. And the reason that you use gel is because it protects the skin, but also what I find is that it helps you to glide the handpiece without sticking to the skin. It can be used as a pick and place, but if you're doing big areas, you can glide. And for gliding, you do need the gel so that you can, there is that ease on your hand and it doesn't stick to the skin, and obviously prevents you having any burning or any damage on the skin. This is how the ET and the XC look. Obviously, you can see you can pick and place, or you can drag the handpiece. So again, the 3 pieces. Okay, these are some of my patients. This is with the ET. The first treatment. The second, this is literally straight after, just post laser. So I just wanted to show you that the skin is not, there is, obviously there is no irritation to the skin at all. And this is on her 4th treatment back. And this is obviously without pre-shaving, nothing. The patient hasn't been treated as yet on the 4th treatment. And you can see the difference. There's literally virtually like 3 or 4 hairs left. Same with this patient's stomach, first treatment. And the second picture is on the 4th treatment. So the beauty of the diode is that, again, even when you're treating skin of color, like say a skin type 3, once you get to a position of like the 4th or 5th treatment and the hair starts to become finer, what you can do, and you have the ability to do, is you can actually take it to a shorter pulse. So you can take it to auto, and you can then treat the patient a bit more superficially with a little bit more power, a little bit more energy, and that gives you that real kick, gives you a better result. You don't necessarily always have to be on 30 milliseconds. The reason I'm showing you this picture of this patient is that I want you to know that laser hair removal is not always just, like I said at the beginning, just a cosmetic thing, just where someone goes and has it because, you know, it's not the same as waxing or shaving. This is for some people who have a hair problem. This is a serious problem. And personally, I would rather, whether they're coming for whatever it is they're coming for, my first port of call is if they have facial hair, that is the first thing I treat. Because there is nothing, it doesn't matter what you do. If you do a peel, if you do skin rejuvenation, whatever it is you do, it really doesn't matter, because as long as a patient has facial hair, their skin's not going to be perfect. So this is an important factor in aesthetics. This is the patient after we had lasered her. Obviously, the patient was pretty bad with acne, so she was on steroids, etc. But we had to do laser hair removal on her. And this is that same patient. So huge difference. This is another patient who came in. She came in for acne, but you know, I was not going to treat her for her acne or for her skin till I had actually got her to commit to laser hair removal, because half the problem was her hair on her face. And again, you can see the difference in literally just giving her some products and doing laser hair removal on her. This is a patient for lesions 8 of, with the diode. She's not my patient. But again, you can see the difference in the pigmentation, the sun damage. This is a patient of mine, again, an 18-year-old girl, shaving pretty much, I think, twice a day. And this is the difference in her skin. So we're coming back to, so laser hair removal, I would say, is definitely up there in the 10 most important treatments. It is a profitable business if you do it right, and don't cheapen your own brand by thinking that laser hair removal is not an important part, because it, like I've said, you know, it can be profitable and it can be good if you get the right machine and if you get the right patients. Staff training is important. Make sure that you know how to use your machine before you actually try to expect your staff to know how to use it. Because if you don't know how to do something, then your staff are not really gonna. You're not gonna know if your staff are doing something right if you can't use your system yourself. Keep your prices. I'm not a believer in treatment deals. I tend to stick to my prices, and if you are doing a promotion or an offer, maybe do it once or twice a year, but try not to do it all of the time, because patients will never want to pay the right price. If you are constantly giving them an offer, they will wait for that offer. They will never want to pay you, your normal price. Treatment plans. It's important, again, to make sure that if you do have a staff member and if they're treating, just go through the treatment plans. Just make sure that that the treatments are done right, that the settings are done right, because sometimes if you don't check your staff, they tend to do the same thing and they just repeat the same treatment plan. Obviously, patients change, their hair changes, their skin changes, so obviously that's important. Customer support, which I spoke to you about, which is where you buy your machine from. Just, it's important that you have a relationship with that company, and I think that's a big plus. Patients' expectations. If you have a patient that you think you can't meet their expectations, and this goes to any cosmetic treatment, then the best thing is not to treat them, because for example, if you have someone that has very let's say they have fair hair, blonde hair, it's going to be very difficult for you to give them a good result. So it's better to be honest with them and just stay away from them, and maybe give give them another treatment like electrolysis, etc. And obviously being a boss obviously is not easy. Being somebody that owns a clinic and runs a clinic is not easy. But what you do is you choose the right systems, you choose the right treatments, and you support your staff. And by doing a combination of all of these things, you end up having a successful business. So I hope that was interesting, and I hope you've learned something. Obviously, this webinar was more to do with the system and introducing the system to you. Hopefully, on maybe another occasion, we will be able to talk to you more about treatment protocols and settings, etc. And now I'd like to hand you over to Dr. Cartier.
Okay. Okay, thank you, Heina, for your kind introduction on your perfect field of the relationship with patients, field of the possibility to increase the indication with only diode laser. It was a good surprise for me. Even I start depilation 20 years ago with IPL, and I was very happy with my old IPL, and I discovered alexandrite and DIAG, the combination of both, more than 20 years ago, with a good device, and it was a very good surprise also, another planet for me. But since few months, we have a new boss in our clinics. It's the Splendor X, because with the Splendor X, we discover a new field to treat some patient and to increase the business efficiency, to reduce the pain. We will discuss just after in the next slide. So it's many things at each time, and thanks to Luminis for me, because it was a good surprise with this new device, and I try to explain that. So I'm a dermatologist, phlebologist. Organized congress since many years. I work at the hospital or in private practice, and I use IPL, many books for many things, but it sounds very important for that, just to know that I like to be a dermatologist. So what we want to expect from patient, we try to reduce the pain, because when I discovered the depilation 20 years ago, it was a little painful, it takes time, it was a small spot. Now with the new possibility, we have a less pain, fast treatment, and it's very important for me and my assistant, you reduce the smoke in the room, because when you want to use the combination of alexandrite and Nd:YAG, the problematic is always the same, is the smoke, and it is not very happy for patient for the treatment in this room just after many patients. When you have many patients in the same day, it's not very helpful. So with my Splendor, we discovered a new field, because we feel that we believe that we have around 20% less pain, 20% faster treatment. So it's a big problem, because more you are fast, less you have time to discuss with your patient to other indication, aesthetic, cosmetic. So it's more fast treatment. So maybe you have to be careful to have to take time to explain with your patient that it's faster than the other device. You should be treated for that. So it's a reason. So be careful, because when patients say it's faster than with other device, you can decrease the price of the session. We said no, because now it's faster, it's less pain, and it's more efficient. It's more efficient with a new device. So it's a reason we were very happy with the Splendor X, and we increased our business since we bought it. What we can do with Splendor X? Splendor X, the first thing is it's well known, because you have alexandrite and Nd:YAG, so you combine the both. But in the device, because we have also older device, so some patient can compare the difference between the both, and it's very big difference with the old one on the new Splendor. So you can use alone alexandrite or alone Nd:YAG, but you can also combine. We can have a lot of discussion between the combination of the both, but you have the possibility to have the choice. And the most important thing is to have the possibility to choice. And the second thing very important is the cooling system on the flume evacuator. It's very important for my practice because we see a lot of patients. We have clinics, only one, but big clinics, more than 500 sweater mirror, and we have more than 15 laser devices in the office. So it's very important to be very organized. So it was very important with the Splendor, even Splendor X, it takes a lot of place. So you need big rooms to be sure that you have enough place to use it in a good hand, this device. So the most important is that you can have the possibility to synchronize the two wavelengths. You have the possibility to have more indication as expected with not only depilations, and it is very revolutionary for us. You have the possibility to have the choice between spot size, square. So we will discuss just after. So is well known for the combination of the both. You know, everybody knows if you have some laser in your office that you have the alexandrite. It's well known. It's well known since a long time. And the YAG is a very powerful. The NDIAC deliver a lot of power deep inside in the skin, so be careful. But with the combination of the both, you can expect a beautiful result for fast treatment in a removal. So you know the hemoglobin absorption is well known. You know the melanin absorption also. So it's a reason you can use your Splendor X in another indication that hair removal. You can with alexandrite if you want to. You can reduce. You can destroy some dark spot. If in good hands, you can reduce some angioma, planus angioma, or white spot. You can also, with NDIAG long pulse, you can destroy ruby spot. You can use telangiectasia of the legs, many things. And in a fast motion with a low sitting with NDIAG, you can also reduce wrinkle or acne, active acne. So you have not only indication for hair removal, but as you know, you can increase the possibility with this device also, because you have the possibility of the two wavelength. So what we advantage of the synchronization of the combination with the both, that you can go deep and you have two targets, maybe more target, because you have the melanin target, you have the vascular target, and you have the water target. So with a combination, you can go deep from the deepness to the superficial skin, so it's easier to reduce all type of hair follicle. So it's very important between the vellus hair to the deep follicle hair on back of a man. And we know as it's so difficult to reduce from back from men, so easy for on a woman, but be careful for lips. It's always the same on the face. You have to use carefully, and sometimes it's necessary to use a combination of the balls at each in each place of each patient. If you want to start with alexandrite on the phototype 1, it's not necessary to use NDIAG, but you can also use both if the skin is very thick, you know, to be sure that you can join the deepness where you have the bulge of the follicle, the matrix of the follicle, to destroy definitively with a faster treatment and to reduce the number of sessions. So very important for patients, because even you can increase the price, the finite price, but you can explain that you need maybe less sessions than with other old device. So with the possibility of combination, you can treat every patient you want, different skin type, men or women, from phototype 1 to 6, but be careful for phototype 1, only one alexandrite, and for phototype 5 and 6, and the YAG only, it is normal. So you can treat more patients than ever. You can more application because you have possibility to increase the number of inclusion, vascular, melanin, pigmented lesions, and some wrinkle or acne. Active acne is very interesting, and you can treat and use your device all on full during all the year. So it's very important. Even I live in north of France. Everybody knows that you have not a lot of sun, but we have some patients that are coming from everywhere, so we can treat with many possibilities for each patient. You will see on this touch screen, you have a touch screen, so it's very easy. Like for the diode from my colleagues, you have the possibility to change very easily. You have the white spot, or you with your finger you move, and you can change very easily the fluence of the both wavelength. And exactly the same for the flume evacuator, exactly the same for the Zimmer, because you have all included in the same device, and you can also modify the time delay emission until 3 milliseconds if you want, like the best device you can find on the world. So you have many applications and many indications on the possibility of setting. You have an automatic mode, so everybody can understand that is very easy, but you have also, you can modify the setting like in an expert mode if you want. So what we can discuss about with return of investment, that you can, it's difficult to compare with the other device, because when we look, the old device we have, it's well known in the world, maybe the most well known. We keep this old device and we use every day. But if we compare with the new Splendor X, it's another planet. And some patients say, but why you don't use this new? Because I prefer the new one. Why? Because it's faster, it's less pain, and it don't smoke. So patients are more happy with the new Splendors and to other, and it's easy to compare because we have the both technology in our clinics. So you can treat and you finish with a thinner hairs, because we know that it's very difficult. So you can reduce at all until 3 milliseconds to have with a high energy, with a big spot, to be sure that you cover all the area and to destroy definitively even the thin hair, the vellus hair. We know that NDIAG is safer wavelength for every skin type, and if you want to use NDIAG for all phototype, you can also, because we have some colleagues, they prefer to use always NDIAG. It could be a surprise, but you can have some beautiful result with only NDIAG. It could be a surprise, but if you reduce the time emission with a higher possibility of with high fluence NDIAG, it is possible with the Splendor X. So it's also in very interest for each doctors. We have confidence with NDIAG because they bought only NDIAG laser. If you want to use a Splendor, they can do that. So it's very easy, and you can treat everybody all during the year if you want. What's the advantage for? So for the first time, a company understands that if you treat with a specific handpiece close with a cooling system, with a cryo touch on the very important the cryo curve, and also with in the same handpiece a plume evacuator, you have a close place to be sure that you don't have the dispersion of the air cooling, and you absorb immediately after that some smoke. So it's easy to understand that because you have a small handpiece for that, all include, you reduce the pain because you are more efficient to reduce with combination of the hair cooling system in this small size. So it's very important because with the other device you have a dispersion of hair. With this handpiece you have all in the same handpiece. So it's very easy and it's more comfortable for each patient. So it's a design, it's a very good idea to do. We would like to have that many years ago. We discussed some colleagues why they don't do that. But now with the Splendor X, it's easy. You have all included in the same handpiece. The smoke elevator, the both wavelength in the same fiber, and we have the cryo air and the cryo touch to cooling the skin and to reduce the pain and the risk of the burn risk. So why it's very important to have the plume evacuator, because if you go in a clinics and some colleagues have a classic Alexandrite NDIAG, you can smell the smoke, and it's very, very, very it's not comfortable for everybody. So you need some cooling room. You have to smoke evacuator. So it takes money. You use a lot of electricity because it needs more fan, many things to do with the small with the Splendor X. You have all included, and you reduce the smoke evacuation. It is very important for my assistant, for me, for my nurse, and for my patients. So to be sure that we reduce the risk about the more than 300 chemical compound we have in the flume, I think with the new Splendor X is better and is easier to work without a mask, okay, to reduce the possibility of inhalation of the vaporization of air. So it's very important is we are more secure with these patients, and I suspect that we could have some trouble in the many years. So it's the first reason we bought the Splendor X is a smoke eradicator. And just an example that is very efficient, that with the old alexandrite and diag combination with all device, we have to change the window, the protect window every day, maybe 3 or 3 times a day, because you have just a pulse air. But with the new handpiece of Splendor X, we don't change the window since 6 months, only one every 6 months. That means that you have good efficiency between the air cooling and the smoke evaporator. That means you have no carbonized air coming close from the window. So it's very important, and it's a demonstration that it's an efficient handpiece for that and for you. So you have the photo on the slide. You have the Zimmer. It's well known. It's more efficient than the older one. We have the another one also in your office, but we can see the difference between the cooling and the efficiency of the new device, and it's very efficient to reduce the noise, the efficiency, and contribute to the pain. So very important for us. And you will see on this picture the thermal effect. You will see the blue, the dark blue, that you have cover exactly the area you need with your new handpiece. That means that you reduce really the skin temperature. It is very important to reduce the pain and the burn risk. Very important and very efficient because you have no air around and dispersion of the air. So very, very important for us, and patient feel that immediately when we compare both techniques, both different company, because we have more than two devices for depilation, they can feel that immediately. So it's well known also, it's a Monte Carlo modeling scattering effect. Everybody knows that more you have a larger spot, more you can go deeper in the skin to reach the bulge on the unit, follicular unit, to be sure that to destroy all the follicle and for best and fast treatment, and to reduce the number of sessions. Nobody knows really how many we can reduce because it's depending so many patients, but I expect we can reduce from 1 to 2 sessions for each patient for that, even because we can use now a large spot with a large diffusion of the wave of the light, of the photonic effect with high frequencies. Is very important because Splendor X is maybe the most powerful and with the most power with the NDIAG and alexandrite in the if you compare to all the other devices. So it's very important. You can go fast with the high frequencies with a large spot. Is the reason we bought it when we compare. Another reason that we have with the Splendor is we have a square shape spot. So it's very important to be sure that you have the same energy in the diffusion in the skin all around all the spot side, because it's a square shape spot. It's not a Gaussian emission, so like the old one. So it's a very efficient to be sure that you don't forget your laser, don't forget some area to be sure that you destroy all air follicle. Another advantage, it's you have the choice between the traditional round spot and the square spot. You know, when we bought the Splendor X, we were maybe old-fashioned, and we discussed with the company, and they said, okay, we want to buy only the round spot. And we discussed with my nurse and assistant, my other colleagues in my office, and we discussed, and they said, no, we keep the round spot. And they make a mistake. It was funny, but only we received the Splendor X with a square spot. And after 1 week, we decide to change in our brain and to stay, we keep the square, because with the square, it's easier to understand that you reduce the number of spots because you don't forget some area. It's easy to understand that. It's more precise. It's easier for my assistant and me. And if you want, with a square spot side, you can use this technique. It's funny to understand that how it works. It's a UV ink, and with when you bought the Splendor X, you have the possibility to have a UV spotlight, and you can recognize and can you see where you are. So it's very easy to follow the small square spot and to avoid to miss some square, some area. And with that, you have a more precise techniques. When we look in alert in case or many alert around the world, and we saw some burn patient, we are very surprised by when we saw some burn patient with after alexandrite. We saw many pictures that the colleagues forgot some area. With this device, you cannot forget. It's very, very, very interesting because you have a more precise treatment, and it's a reason also that you can reduce the number of sessions because you don't forget some area. So you have a more efficiency, less pain, faster treatment with a large spot, with maybe the more power you can find in the world with this new device, and you don't forget some area. It's a reason we bought this Splendor X. It's very easy to understand that also. So the next slide. Up. So next slide, you have some results. You know, when you have a back or on this man on decolletage, is understand to be sure that you don't forget after maybe 400 or 500 shot that you don't forget some area. So it's easy to be sure that your patient was after that he is happy for that. It's a beautiful picture from Leonardo Marini, colleagues from Italian, well-known past president of ESCAD. He will show you some results with vascular disease. Be careful with the NDIAG because NDIAG is very stronger and very power emission. So you have to have a good setting. But for this large telangiectasia, you can use it in a fast motion to reduce redness, but also with precisely you reduce the spot size of the NDIAG until 2 millimeters. And you follow the telangiectasia to destroy in one session. It's easier, and you have always a touch screen to help you and to have to take the good decision to be sure that you don't make something wrong. So it's easy to use a Splendor X, even you are a young practitioners, to reduce rosacea, venous leg of the lips, legs vein on the legs vein, on spider vein if you want, on some warts, because you have a lot of power in this device, so it's easy to destroy some warts with NDIAG. Even you can use alexandrite also. You have some paper on that to be published. So you have the possibility, the last thing, you have the possibility with the Splendor X to have the choice between, you can both only Alex and combine with NDIAG, but if you have only phototype 1, 2, and 3, you can buy, if you want, the Splendor X, but with the 2 Alex in the same laser. That means you can increase the power, and you will be more power on more larger spot with the 2 Alex and only 1. It's a reason some colleagues, they prefer, because they have maybe 80% of patients, they have phototype 1 to 3, so prefer to both Splendor X with 2 Alex laser in the same Splendors. So we have the choice possibility. We discuss a lot in my clinic, but because we have maybe 70% of patients, they have phototype 1 to 3, and 30% they have a phototype 4, 5, 6, we prefer to have the combination of the both. And you can explain that if you combine the same in the same shot, you increase the finally energy and you deliver more energy than the 2 wavelength alone. So it's a reason, if you want, you can use Alex alone, you can use NDIAG alone, but you combine the both on a phototype 1, 2, 3, 4, but be careful, because after that you have to reduce the alexandrite energy, very important. You have the accessory smoke, handpiece on Zimmer, very powerful Zimmer, very efficient, and you can make a lot of indication on onychomycosis if you want, but it's difficult to discuss because for us it's more cosmetics than treatment. But you have some skin technique with the NDIAG short pulse on the fast motion. You can destroy warts, pigmentation with alexandrite or vascular disorder. So you can do many things that you can try if you want by this device. So it's very fast treatment. You have a lot of energy, a large area. You spend 20% less time to treat the same area for legs or back if you want, because for lips or for face is very easy and don't take a lot of time. But you have the warranty of the lamp, and you have change it if you know, because you have the possibility to replace the self lamp if you want, but sometimes you can ask your engineer to make this job. But on the small, the 6 point is very important. You have the smoke evacuator. It's more comfortable for all, or maybe more secure for your assistant, nurse, and doctor and patients, and we have no consumable, so it's very important. It don't cost a lot because you have the Zimmer included, so and you reduce the number of changement of windows. It's very important. We were surprised when we bought the Splendor X. I called the company. I said, I want to buy to use some windows because we have a lot of problems with the older device. And they said it's not necessary. You will be surprised because it's necessary to change every day the windows to protect the laser. And they're completely right. Since 6 months, we don't change. We don't change the windows, so it's very helpful. So reduce, because the protect window is very expensive at the end of the years. Thanks a lot for your understanding and listen to me. Thanks a lot.
Thank you very much, Petrina and Dr. Cartier, for the very interesting presentation you made tonight. So we are now going to begin answering the questions that were submitted during today's presentation. As a reminder, you can still submit the question through the question pane in your attendee control panel. So we are going to answer the first question we have. Would you please explain the relation between intensity, frequency, and pulse duration? I don't know who from you, Petrina, or Dr. Cartier, want to answer this question.
I think Dr. Cartier.
It's a good question. It's a basis. If you want to use a laser, I'm a writer. I write a book for that. Okay, so I'm not sure that usually it's time to explain that it's a basis. So if you want to buy a laser, we explain. We have good explanation in different books to explain the necessity to have a spot size, the frequency. It doesn't care, you know, frequency of what, of the shot, you know. We can discuss about frequency also, but between the other point is a basis in laser treatment. So, but for frequency, the most difficulty with this new device that it's not so easy for every doctor to be coordinate. It's very important because when you can go hunt 3 Hertz and try to use 3 Hertz with a big spot, so it's not so easy. And I know in my office some colleagues, they can't use the high frequency because it's too fast. So 2 Hertz is generally common, but more that it's not so easy for a lot of patients or a lot of doctors. So be careful to be sure that you don't forget or you don't overlap. If you are a young practitioner, stay between 1.5 or 2 Hertz, no more, because it's not so easy to treat with the fastest as a possibility of the device, because the Splendor X has more possibilities that you can, and maybe it's not so easy to follow the spot on the shot.
Thank you, Dr. Cartier. I have another question, probably for you, Petrina, after the photo that you were showing. How far up are the skin rejuvenation treatments? 4 weeks or 2 weeks?
Sorry, for which photo? For the skin rejuvenation?
Yes.
Normally, when we treat for skin rejuvenation, we do 4 to 5 weeks apart.
Okay. And how many treatments do you need in total?
In total, look, like I said before, but normally, you know, if you had a choice and if you had like an M22, you would choose that. But if you are going to use the diode for it, then I would say it can take anything up to about between 3 to 6 treatments. I personally, this is a difficult question for me to be accurate on because I have the M22. You know, we wouldn't choose the diode over the M22, but from what understand from people that have treated, they can get a good result, anything between 3 to 6 treatments?
It's a good question. You know, when you have some patients, they have redness and they want to use NDIAG with a low fluence on the 0.5 millisecond, and you make many passes on the patient, and they feel better, and they reduce the rosacea, the erythema, the sensitive skin. And after that, they continue because they feel better on the skin texture. So it's a reason when we speak about NDIAG long pulse, never patients have to stop. And they come again, and they come again. Not really maybe 4-6 times a year. You have maybe you start between 6 to 8 sessions every 3 weeks, every month. And after that, they come again only to do just a fast motion with a low setting of NDIAG emission. So it's very funny because at first it's not for the good reason, the same reason, but the patient continue only with the NDIAG because they are happy with that and they don't want another laser. Even like now we have also M22 on the active FX in my office with more power, but not so easy to manage on every patient. But M22 with a resurface 6 is also good indication for small wrinkle because you have in the M22 searching for periorbital wrinkle also. Yeah. But with the two dive as a diode, you know, because you warm the skin. So when you warm the skin, you modify the structure and the texture of the skin. But with this gentle, it's a gentle treatment. You have to continue the treatment. It's not, you can't say to your patient that only 3 sessions is enough. You have to continue the session to explain that. But it's not very expensive. It's very easy. Patients have no downtime after that of the session. So it's easy to propose to many patients.
Thank you very much. And we have a last question tonight. One of our participants is asking if Dr. Cartier, if the Splendor S can be delegated to your team.
It's a good question. You know, in France, it's an incredible country. You know, normally it is forbidden, but not for all. So we have nurse and assistant. They have a specific diploma for that, and they do by us. With we are always in the same clinics, you know. We are four colleagues, 4 dermatologists in my clinics, and we decide the setting. But sometimes we do that, but for black skin, for some patients with some problem, for Verneuil disease or hidradenitis verneuil, you know, hidradenitis infection disease. But for classic area, we can delegate to my nurse. Yes, we do that. Because for the setting, you have the automatic mode, so it's very easy. When you use another Alexandrite and NDIAG combination, another company, you have nothing on the touch, you have no touch screen, you have nothing on the panel, so it's very difficult to have the good setting. But with the Splendor X, it's easier, and for young practitioner, on the young assistant, you can delegate. Even you have to be in the same area and to decide with the patient and the assistant what the good setting for the patient.
Thank you very much for this answer. So that concludes today's webinar. Thank you very much, Petrina Nugawela and Dr. Cartier, and thank you everyone for attending today's webinar. If you have any other question or if you like a recording of the webinar, please feel free to contact me directly. On behalf of Luminis and our presenters, thank you for joining us today and have a great evening.
Thank you. Bye-bye.
Thank you. Bye.